Lately I've been so stuck in my head that I forget just about everything my therapist said. Maybe I'm self-helpless.
Hey everyone, welcome to Self-Helpless. I'm Delanie Fischer, and today I'm chatting with Dr. Dave Rabin, who is a board-certified psychiatrist, translational neuroscientist, and inventor. And we are talking about the future of mental health and medicine, including the efficacy of psychedelic-assisted therapy and technology-based therapeutics, what our healthcare system could look like in the next decade and beyond, and some seriously reality-shattering discoveries and theories around the nature of consciousness. I felt like I time traveled to the future with Dr. Rabin in this episode. I found this information beyond fascinating, and it overall made me feel hopeful about the future of health and wellness. And based on the current findings that we discussed, it just made me wonder what else could be possible if these things are already working and they're in the early phases. What else is going to be discovered in the coming years, and what does that mean for all of us? It really ticked all my favorite boxes: cutting edge science, ancient wisdom, and innovation. P.S. You can also get this episode completely ad-free on Patreon at patreon.com/selfhelpless. All right, here is my conversation with Dr. Dave Rabin. What was a paradigm shift for you when you were first starting to learn about or study neuroscience and psychiatry, whether it was before or after your conventional education, or maybe even a memory you had as a kid that got you interested in this stuff?
I think the most quintessential paradigm shift for me was around it must have been around like 2010 when I was doing I think I was still in like the heart of my neuroscience and medical training.
Okay.
And I had learned about some work that had been done at the NIMH, the National Institutes of Mental Health, around a program called RDoC, which stands for Research Domain Criteria. And this was a way that Tom Insel, who is the former head of the NIMH, was trying to figure out how to basically compile all the evidence of all the research that had been done to date, to try to figure out what is at like the root cause. If we can find a root cause of mental illness, for instance, like what is the root cause? And what really stood out to me from looking at that work, and I think what resonated really closely with me, with my patients, was that it seemed like everyone who was diagnosed with a mental illness had some history of past traumatic events, whether they realized it or not, or noticed the connection, or whether their doctors noticed the connection. Didn't necessarily matter. There was a history of some perceived sense of traumatic events that had happened, or even one event that had happened. And I was seeing this in my patients regularly, which was that whether they came in with diagnosis of depression, PTSD, anxiety,
Yeah.
schizophrenia, you name it, bipolar disorder, there were always these very distinct moments in their lives that they would go back to when you really started to get into conversation with them. And sometimes it would take a few sessions of figuring it out, but where the traumatic event would really you start to draw the basically like when we were kids, like drawing the lines between the dots on the Denny's menu, that's what I felt like we were doing. And as like a clinical medical mental health detective. And that was really cool because I think up until that point, the DSM, which is a diagnostic manual for mental illness that many, many people talk about and now in the general population know about.
Right.
It's really a billing manual, but it's become the manual for the way that mental health diagnosis is taught in most Western institutions, which probably isn't the best, but that's just what we've got. That doesn't really talk about this idea of trauma being at the root cause of most mental illness, unresolved, unprocessed trauma. Yeah, so like that's not that hasn't been mainstream. I still don't think it's fully mainstream in Western medicine, but the evidence certainly there. So when I started to make this connection, it made me realize that, perhaps this is why a lot of our Western medical mental health treatments aren't working, because they don't actually get to the trauma, they don't get to the root cause, they just kind of numb our feelings of the result of what happened. Like if the traumatic event made us feel bad or like a victim or like less confident or whatever, or sadder, than or more ashamed than the medicines that we use. They're great for stabilization, but a lot of them are just numbing us to those feelings. They're not actually helping us rework our memory and our meaning around the traumatic event. So
Right.
it's really interesting. So then I started, from that moment, it's probably about 2010, I started to take a completely different approach to mental health, where I started exploring everything outside the box that we were taught in Western medicine, like deep breathing, meditation, mindfulness, yoga, vagus nerve stimulation, soothing touch, soothing music, psychedelic-assisted therapy, wearable technology. Like all of that stuff became extremely relevant in that moment, because the way that because trauma and PTSD and mental illness are really like, it reframes them as learned fear disorders. That's
Yeah.
the way they're represented in animals. So if they're learned fear disorders, then how do we treat learned fear? We have to treat learned fear by relearning safety. And so that became kind of, in that moment, I didn't know it quite yet, but that became the major focus of my work for the next 15 years.
That is fascinating, and I would think that this would be more mainstream by this point, but would you say that the more mainstream school of thought is that if somebody's getting a mental a disorder diagnosis, is the explanation because it's hereditary, it's genetic? Yeah, how's that being explained to the person on the receiving end?
I mean, it really depends on who you're talking to. In general, it's not being fully explained. We're still not, as a mental health system, as a community, unless you're working with like a highly trained psychologist or somebody who's like really, really well grounded in psychotherapy techniques, where they teach this kind of stuff about safety and meaning making and that kind of stuff regularly, and much more so than they teach like nurses and doctors. You're not going to get much of this at all. And so
Mm,
I think that, and most people who are patients who have mental health disorders don't get diagnosed by a psychologist. They actually get diagnosed by a family medicine doctor or a nurse practitioner or a physician's assistant or a psychiatrist. So
yeah,
the psychologist then comes in as a therapist later, after the diagnostic damage has done, for lack of a better term, because the diagnosis without an explanation is actually very confusing for a lot of people, and
right.
mainly because mental illnesses in our Western paradigm have no cure. So when we hand somebody a diagnosis without an explanation of, why they might have it, or what might have happened to them that might have resulted in it, or what the impact of it is on their bodies, or how to recover from it, or whatever, all the things we do for physical illness, we don't
Right.
do that for mental illness. And so people are kind of like walking out of the office being like, oh, well, now I finally have an explanation of why I've been feeling so shitty for so long, but I don't
Yeah.
know what to do about it. And I feel, and many people feel like they're stuck with that diagnosis for life, because there isn't a cure in Western medicine that we talk about with mental illness. So basically, we hand people a prescription, and one or multiple prescriptions, and we say, take this every day, and we'll keep monitoring you. And if you stop taking it, you're likely to relapse more often than not. And that encourages people. That kind of perpetuates this narrative of mental illness is like genetic, or is something wrong with your brain, that's why you have it, or that you're going to be sick with it for life, guaranteed. And neither of those three things are true in most
Wow.
cases. So I
Yeah.
think that's really an interesting paradigm shift for us to consider, which really culminates in this concept of, well, what if mental illness is in fact curable? What if we change our tack in terms of the way we're thinking about this to address the root cause trauma at the core, or at least start to tease that apart? Perhaps we can develop cures for mental illness. And that's where I think psychedelic medicines are really on the forefront, which is very exciting.
Yeah, I have so many questions about psychedelic assisted therapy, but I'm curious about your thoughts on, do you think we're getting closer to kind of like an implosion, if you will, in the mental health field of having too many disorders, too many labels, too many medications? It seems like we get new ones every year. Do you think at some point this is all just going to kind of spontaneously combust? And like you said, there's going to have to be a new way that we all think about mental illness and the root cause. Like, how far away do you think we might be away from something like that?
It's a great question. I mean, I think these are questions we should all be asking. If we look at the statistics, and anybody can Google these statistics of how common mental illnesses of all kinds, including depression, anxiety, PTSD, substance use disorders, bipolar, etc., ADHD, how common are those every year, year over year, for the last 10 years? There's a pretty significant increase between 2015 and 2020, then COVID happens and there's a sharp increase, huge,
Mm-hmm.
and no signs of it turning around.
Right.
And when you look at the financial impact of that to our healthcare system, to us as individuals, to our society, untreated mental health issues are arguably one of, if not the most expensive patients to have in your society. So some of these folks who are untreated or improperly treated mental health patients who go to the hospital frequently or can't work regular jobs or can't work at all, can't participate in their family life. They end up getting a lot of other illnesses. They often end up abusing drugs because they're trying to feel better and things they're being given aren't working. And so it winds up being a very slippery slope, and it's literally bankrupting our entire healthcare system.
Wow.
So that is really the problem, which is that, and we can see that I think nothing is clear in terms of evidence that what the current strategy that we have in terms of just stabilizing people perpetually and numbing them to their symptoms for mental
Yeah.
health chronically for their entire duration of their lives is not satisfactory to this. It's not only not satisfactory as a solution, but it's not working, right? Like if it
Yeah.
was working, we would see the numbers of people with mental illness start to at least even out and then eventually start to go down. But we see the complete opposite, is just going through the roof. So we need to ask ourselves at some point, where does the current system have its strengths? And I
Right.
would argue that this current system has a ton of strengths in terms of stabilization in the moment when people are in real trouble in the moment. But where our system really lacks and where the most of the damage ends up being done and the expense incurred is after the stabilization, which is in people's regular day-to-day lives in the outpatient home work setting where they don't have good, reliable treatment and tools to take with them on the go, which go beyond stabilization to, again, like treating the root cause of the problem. And that's that's what we're talking about, where I lecture a lot on kind of the impact of the discovery of somatic techniques, wearables, vibration-based technology, music therapy, and psychedelic therapy, and how all these things together really represent the next paradigm shift that we're seeing in mental health, which is to actually start to introduce curative treatments, and curative treatments get people to remission. And when you start to see, you could measure this. Like, the beauty of this is so measurable, right? Is you introduce the treatment in a controlled setting, and the numbers of mental illness, rather than going like this year over year, start to level off,
Yeah.
and then they starts to decline, right? And so that's kind of the 5-10 year plan that we are working really, really hard to implement and teach people about, because it's an extremely achievable and hopeful opportunity that will, in fact, rescue our American healthcare system. But until we start to think differently, we're just going to be setting our healthcare dollars on fire.
Could you give us an overview on how these tools work? And then, of course, we'll get, deeper into them. So, touch therapy, vagus nerve exercises, psychedelic assisted therapy, wearable technology, whatever you want to share about those.
Sure. The way I answered your first question about the first paradigm shift that I really discovered for myself in my training was around how safety has to be relearned to treat people who are having symptoms from untreated or unprocessed, unresolved trauma,
Yeah.
which is learned fear. So if trauma is learned fear, we have to treat learned fear by relearning safety. And relearning safety is actually represented biologically in our bodies and brains. And it's represented by activity in the vagus nerve. So the vagus nerve is the primary nerve, called cranial nerve 10, of the parasympathetic nervous system that comes out of the brain and brainstem and innervates almost every single, if not every single, organ system in our entire body.
Yeah.
And what it does is it's activated by soothing sensations and by feeling safe. So if you're safe, meaning there's no lack of, you have enough food, you have enough water, you have enough air, you have enough shelter and physical protection, and you have enough sleep and enough connection to your community, or to anyone around you, then your vagus nerve activity can go up. And you can also naturally increase your vagus nerve activity by doing techniques like I mentioned earlier, which are slow, intentional, deep breathing, gentle, slow movements, qigong, tai chi, other kinds of movement meditations,
Mm.
yoga, Soothing touch rapidly increases vagus nerve activity if it's from someone you like and feel safe around. Don't feel safe around, caveat, doesn't do that.
That's a big one. Yeah.
Right?
Yeah.
Especially for women. So I think that's something
Yeah.
we don't think about a lot, but that's like that's a major issue in general that is really important to understand. That there's an emotionality to these different sensations. Soothing smells, like the smell of your favorite food your mom was making when you're growing up, um, but the soothing smell that makes you calm because it gives you fond memories of your upbringing and childhood is not necessarily the same smells that are going to make me calm, right? So it's a very personal,
Right.
emotional, meaningful component to this. And but the core of it is it all boosts vagus nerve activity. And when you boost vagus nerve activity by doing any of these activities, natural or like on your own by choice, or because you were just exposed to it, like you walk into a room at the end and you're at work at the end of the day and one of your favorite songs is playing on the radio and or on the speakers, and all of a sudden you forget how crappy a day you had that day because you're just in the moment with your favorite song. That's a universal human experience of safety. and
Mm.
and that's a vagus nerve activated experience. And Apollo, which you could see me wearing on my chest, is a tool that we developed to deliver soothing touch vibrations to the body that also boost vagus nerve activity. Effectively remind feel it feels like ocean waves or like getting a hug or holding a purring animal, and it boosts vagus nerve activity by just reminding us that we're safe. Psychedelic therapy amplifies safety pathways in the emotional brain, as the chemicals specifically do this, but in the context of a safe therapeutic setting. So if you have uh, therapists with you, guides that you trust, that you feel completely safe, non-judged, and not judged to be around you, and you feel like you can be vulnerable with them and be your true self without concern. The presence of those people in the accompanied by the administration of the right dose of a psychedelic medicine will potently amplify safety pathways in the emotional brain, which over time help in the moment help people to remake meaning around past traumatic events over time, resulting in great increases in vagus nerve activity. So that's why this is to me so fascinating, because a lot of people say, oh, you can't look at the body or mental health or disease with a reductionist approach, but I can tell you without any hesitation or reservation that you absolutely can, and that the
Wow.
body is very simple. It's designed very simply and elegantly, and that safety and fear are always counter present, counteracting in balance with each other. So when we're feeling ill, upset, uncomfortable, afraid, scared, any of those things, restless, overwhelmed, we can literally depressed. You can literally just do activities that boost your vagus nerve activity or vagus nerve function in your body, and you are guaranteed to feel better if you do them right. So that's pretty
Wow.
cool.
Yeah, absolutely. From what I've read, the positive results for psychedelic assisted therapy are looking pretty significant with depression, PTSD, postpartum depression, even after just a handful of sessions. I mean, if this kind of therapy becomes more mainstream, isn't that possibly a huge threat to the pharmaceutical industry? And considering how many people are practically on medication for their entire lifetime, what do you foresee the obstacles being or challenges related to that? Or do you think the industry would shift towards these modalities? Like we would just kind of see a different business model on their end if people kind of followed suit?
There's a couple things to consider. For one, ketamine is already a legal psychedelic that's available.
Yeah.
It's not replacing mainstream pharmaceuticals for mental health. It
Mm,
hasn't yet. And it's been available and it's fully legal, and there's like 1,000 ketamine clinics nationwide. We are still
wow.
using Western pharmaceuticals for mental
Yeah.
health. There's still new
Mm,
ones that come out all the time. And in fact, there are so many people who are struggling with mental illness that actually benefit from stabilization, that I would argue, whether the mainstream pharmaceutical companies are expressing concern or not, that they're not actually under threat, and
mm,
that they're going to continue to have very handsome profits for a very long time based on the medicines they already have in their patent portfolio, and that will continue. They will just have to innovate differently. They won't
Yeah.
necessarily be innovating down the same path of symptom suppression and stabilization. They'll be innovating down a path of, well, let's develop better trauma treatments. And we're starting to see that with some pharmaceutical companies that are investing in psychedelic medicine research, right? So this
Mm,
is already happening, and it's just gonna, it's like when cannabis became a tool that was widely available in many states. Philip Morris bought a bunch of cannabis farms, right?
right, right.
So and cannabis companies. So it's like that's gonna happen. Like they're these are billion-dollar companies.
Yeah.
Like I don't think the average person understands the scale, the sheer scale and magnitude of a big pharma company. Like these companies are massive and they're not going anywhere for a long time.
Yeah.
If they innovate and they stay up to date with what's happening in the space, they're going to continue to to drive big revenue numbers and ideally help more people.
Yeah.
I think there is a narrative, which I would argue is a bit overblown, that pharmaceutical companies have something to fear from the burgeoning, psychedelic research and non-drug based mental health research tools that are starting to come out or that are already out. And I just think like even like if you think about MDMA and psilocybin, there are like maybe 400 or 500 therapists nationwide that are certified as trained well enough to deliver MDMA or psilocybin therapy. And those people need to train other people to do that work also. And there's millions of people with depression, like 100. If you probably look at the numbers, there's probably 80 million people in the US alone that have depression and PTSD, and even more if you add on anxiety. So it's going to take us decades to treat all those people with psychedelics. In the meantime, what are they going to do? They're probably
Mm,
mainstream pharmaceuticals, right? And then
yeah.
by that point, there's going to be more people who are, are struggling with mental health and won't be waiting on the many year-long wait list to get access to psychedelic therapy. And also, you can't take psychedelic medicines like MDMA or psilocybin and most others, except ketamine, when you're taking an SSRI. It's not safe.
Oh, interesting. Okay.
So yeah, so we most people don't realize that, but it actually puts people at risk of something called serotonin syndrome, which is usually not, I shouldn't say usually, but often deadly if care is not received immediately. And so it's not a high risk, but it's a risk. And that risk does not exist if you don't have an SSRI on board. So because something like 50% of Americans are prescribed an SSRI or an SNRI.
Mm,
So maybe 30%, 30 to 50% on any given day. So if you think about that, that means that, you know, 3 to 5 out of every 10 people that want psychedelic therapy or will have already, at least that many will have already been prescribed and are currently taking a medication that is contraindicated for psychedelic therapy with ketamine or sorry, with MDMA or psilocybin. And the only medicine that's available for them is ketamine. And
okay.
legally, technically, federally, on a federally legal basis, ketamine is safe to use. It's the only psychedelic that is legal, but it's also the only one that's safe to use with an SSRI or an SNRI on board and doesn't put people at additional risk. Overall best practice guidelines are to taper people off of their SSRIs or SNRIs before administering a phenethylamine or tryptamine psychedelic like MDMA or psilocybin, and that requires a lot of skill and work to taper somebody off of their SSRI. So I think that's the biggest hidden safety concern that most people are unaware of,
Yeah,
and the
that's
ones
scary.
yeah, it's
Yeah.
pretty scary. And
Yeah.
and the safety concerns people are unaware of are usually the scariest.
Right.
They sneak up on you, And so yeah, it's just it's a complex situation. If you can
Yeah.
tell a lot of nuance to it that it's not just a simple,
Right.
it's gonna be many decades before the pharma companies, I would say, have an actual measurable hit from something like psychedelic research.
Very interesting. So we'll see a slow and steady shift. I mean, some things kind of being used in tandem with space in between. You know, that makes a lot of sense.
And they're
Um,
gonna have plenty of time to catch up.
yeah, 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 it sounds like it. So somebody coming in who has not been on any medication, the risk is very, very low to non-existent, basically.
Well, as long as you don't have any of the contraindications. So like
Okay.
contraindications we talk about would be, and these are like pretty well documented, which would be like if you have a psychotic disorder, if you have a delusional disorder, if you have a personality disorder, if you have like manic depressive bipolar disorder, those are generally contraindicated disorders because psychedelic medicines will often have a tendency to make those symptoms worse. And it doesn't require a lot of psychedelic to make those symptoms worse. So like with most medicines, the two major factors that result in the safest experience are number one, patient selection, right? Make sure the people who you're giving a medicine to are the right fit for that medicine. And number two is dose. So if you get the patient selection right, meaning you don't give a medicine to anybody who shouldn't get it, and number two, you get the dose right, then generally you're not going to have an issue with the psychedelic medicine. It's like you're good to go. The other safety concerns are actually relatively minor, and arguably they're much more minor than drugs like Tylenol or which can cause liver failure and death if you take too much, or ibuprofen, which causes kidney failure and death if you take too much, or opiates, which can cause respiratory suppression and death if you take just a little too much, right? Like those drugs are way more dangerous than psychedelics in terms of a toxicity spectrum, like pharmacological assessment. They're psychedelic medicines, most of them you could take a ton of them, and except for with a few exceptions, and you will not physically die unless you kill yourself. Like you'll have the trip of your life, you'll be high for days, but you won't die physically from the overdose of the medicine.
Wow.
Really interesting.
That is wild.
But those folks, anybody who falls into those groups I mentioned, are generally screened out of psychedelic treatment whenever possible. And so we make sure to try to detect that in advance with all cases. But to your point, generally speaking, if all of that's taken care of, there's minimal risk with psychedelics, like less than most other treatments that we offer.
Wow. All great things to know. We've heard that trauma gets stored in the body. So do psychedelics help release the, I guess, tangible tension, or does it give people the feeling or belief that they've released it? Does it even matter if it works, if they feel better either way? Does it even matter how it's working?
I mean, according to the history of medicine, it doesn't really matter how it's working.
Right.
Have you ever had surgery?
Yes, I have.
Did they put you under for the surgery?
Yes, yeah, anesthesia, yeah.
So I don't think we still know how inhaled anesthesia works.
Oh my God, that is so terrifying. We just know it works.
And we use it for 100 years. For 100 years, right? We know kind of how ketamine works, but it has a complex, mechanism that goes across a whole bunch of areas of the brain. It still works, but we don't really know how it works 100% to get the effects. So it's quite interesting. So I would say, like, in general, it doesn't really matter if we know how it works, as long as it works and it works safely. But I think what's interesting is we actually know a lot more about how psychedelics work than most people will let on. in that in that we know that the word psychedelic means to reveal the mind. So psyche means mind, delos means to show or to reveal. Psychologically speaking, that is what psychedelic medicines are doing by effectively inducing a similar state in the brain to what the brain looks like when you're having like a lucid dream. So if you think about like a dream state is when your ego self-protective part of your mind and your identity feels safe enough to go offline.
Yeah.
And then you're able to witness what lies beneath that, which is what Freud and Carl Jung called your subconscious or unconscious material, or both. It's the things what we're not aware of during the day. And that's why our dreams can be so wild and crazy, is because when our ego, our self-protective self-identity mind is quieted because it's safe enough to go to bed effectively, then we're just witnessing all of this material from our subconscious and unconscious stuff that we don't even remember, or that we're not aware of at all, starts to come up, and we get these often sometimes wild and crazy dreams. So psychedelic medicines are fascinating because many of them are working through the serotonin system to activate a couple different serotonin receptors, but one in a very particular way called the 5-HT2A receptor that's really critical to the psychedelic medicine and meaning making process. And when these receptors get activated in a specific way, they facilitate the remaking of meaning. So the ability to change perspective, as one example. And we know that
Mm.
there's a relationship between activity at this receptor site and perceiving meaning. So like that's enough for me. You know?
Yeah. Why do you think it's so important for our brain or consciousness to make meaning out of things or to notice patterns? What is that, a survival mechanism? What do you think that is about?
I think so. I mean,
Okay.
and it's not unique to humans, which is
Yeah.
interesting. So Eric Kandel won the Nobel Prize in 2000 for discovering, with a number of other folks, like the origins of learning and memory on a biological level. And he went back and studied these ancient sea snails called Aplysia, that are 300 million years old.
No big deal.
Yeah, they have like 12,000 neurons, and we have like billions of neurons. So like, but they're 300 million years old, and we're like 50,000 years old.
Wow.
So huge difference in the evolutionary spectrum.
Yeah.
And yet, the way that those ancient snails learn about fear and safety is virtually identical to the way that we learn about fear and safety. And that is what dictates meaning. So, like, it
Oh,
is survival. Like, meaning has a lot to do with things that make us feel profoundly safe, have more
yes.
meaning, positive end of the spectrum, and things that make us feel profoundly afraid have more meaning on the negative end of the spectrum. And then there's everything in between. And the stuff that's neutral just kind of gets like forgotten. But the things that take on either negative or positive meaning are the things that we either want to be stay away from or be attracted to, respectively.
I've never thought of meaning equaling safety before. That makes so much sense. Because, I had a question about synchronicities and how you feel about that. Like, is it the concept of even a broken clock, is right twice a day kind of a thing where we need to make meaning to feel safe? Or are there certain things that really can't be explained? We can use the classic example of, you're thinking about somebody and they call you or text you, right? Is that just a coincidence? Is that intuition? I mean, what is your take on all of that?
I'm going to preface this by saying I don't think science has confirmed an answer to this yet. I've always found this very interesting. I also have these experiences. I think a lot of people do.
Right.
Um, there's an interesting quote. I can't remember who said it. I wish I could because I give them credit, but it's the idea that synchronicities are happening around us 100% of the time. It's just that there's only certain times that we notice them, right?
Interesting.
So like nature is responding to us, our environment is responding to us, and we're responding to it, and we're receiving energy and putting out energy in every single moment. But if our attention is always on our computer, how often are we going to notice when nature responds in a way that's consistent
Mm,
with what we were putting out? We're not.
yeah.
We'll be like, oh, I just thought of somebody and that person just called me. Well, maybe it's a coincidence, but then it keeps happening, right? And if it keeps happening, how is it coincidence? Maybe not.
I love like synchronistic moments and I love talking about woo-woo stuff. I just find it really fun. But my analytical brain always kicks in and I talk myself out of everything thinking, oh, that was probably lodged somewhere in my subconscious and it came up. But it's really interesting to think of that synchronicities might be happening 100% of the time. And we're only noticing some of them. That is really cool.
And I think to
Hmm.
answer your other question about the body, does the body keep the score? How does the body keep the score? This is all related because another big paradigm shift in myth in medicine and general society is that the mind and the body are separate.
Right.
The mind and the body are not, in fact, separate. They were described as separate for the purposes of scientific observation by Descartes in like the 1800s, but they're actually the same system. And we are one system that's composed of both a mind and a body. And so when we are experiencing things up here that feel a certain way, our bodies are also experiencing those things, whether we're aware of it or not. Our bodies are still experiencing those things. And so when we're like emotionally or mentally sick for a long period of time, our bodies will become sick if we don't do anything about it. And if our bodies are sick for an extended period of time, we'll become mentally and emotionally sick if we don't do anything about it. So there's
Right.
like a direct line from one to the other. And so the body is actually a core part of how memories are stored. And this is not really well taught in Western medicine today. It's taught in some other areas of medicine, but not general Western medicine. But it's fascinating because it certainly is a known scientific fact that there's connection that exists, and that the body does in fact keep the score. But it's just, I think the question is, what is the scorecard? And you can start to get a sense of it if you've ever had a really great, have you ever had a really great masseuse work on you, like a shiatsu masseuse?
Oh
Or
yeah, I love a good massage. Yes.
have you ever had one of those experiences where you're getting a massage from somebody who really knows what they're doing, and they press on a certain part of your body, and all of a sudden you have all these memories come up, like vivid memories?
Oh, I don't think so. I don't recall.
Sometimes it's awesome and sometimes it's not. What's interesting is if you that this is a real phenomenon that people can experience where, for example, if something happened to you that made you afraid, and
Mm,
what is one of the first responses to being afraid? Pete, I don't know if you know the comedian Pete Holmes, he described it as
yeah.
protect the neck.
He's been on the podcast. Yeah.
So
Yeah.
awesome. Yeah. So Pete Holmes, like,
Right.
yeah. So it's one of the first things that happens when we're afraid is we protect the neck. We put our shoulders up, right?
Yeah.
And that's an unconscious response. It's just happening in the background. And if we end up accidentally putting ourselves in situations where we are afraid or overly stressed for an extended period of time, then guess what? Our average shoulder height starts to go up and up and up and up and up on a regular basis until we're like this all the time. So then you go and get your massage and you have all these knots in the, mid scapular, mid back subscapular area. And you're like,
Right.
wow, get all those knots, and they start pressing on them. And if you have somebody who really knows what they're doing, they will hit those points in ways that will remind you effectively of what happened when you got them.
Wow, that is weird. It's actually releasing that memory like manifested in a neck knot.
Right.
Oh my
Yeah.
gosh.
Like you can remember the connection in the moment, and then when you let it go, that knot's gone. And then if you stop doing the behavior, it doesn't come back. If you start doing the behavior again or re-expose yourself to the stressors, it comes right back really fast, right? But
So
if you change
weird.
the behavior, it goes away and it stays away. And I think that's a kind of an interesting experiment where you don't even need to pay somebody to do it. Like you can just have somebody, you can just lie down and have a friend or a partner press on the knots in your back, gently, and then a little harder and a little harder and a little harder. And you can do this experiment at home. And it's very, very interesting.
My husband's gonna be very busy tonight. See what kind of memories come up. Since you're involved in consciousness studies, how do you feel about the podcasts like the telepathy tapes or similar topics popping into the mainstream? Do you think that there is something there regarding nonverbal communication that we're going to be finding out? Do you think the new testing around it will debunk it? I would love to know your school of thought on that.
So I'm a huge fan of aggressive scientific testing. And
Yes.
that being said, I think that we often, especially in the modern age that we're in right now, which I would say in science is characterized by what we call the randomized controlled trial age, we forget that there are still valid clinical studies and scientific research can be done that's not a randomized clinical trial,
Hmm.
randomized controlled trial. And all science since the history of science began, when science was like what we call the scientific method of thinking was emerging out of ancient religions, it all started with, this is like 4,000 years ago, we're talking now, it all started with observation, right? Everything starts with observation and listening and detecting and noticing patterns in your brain, not through a microscope, not through a telescope, not with electrical instruments and a whole bunch of crap strapped onto you. It's just
Right.
observation. And
Right.
when you observe something enough times, you start to notice patterns. And then you observe those patterns. Then you find somebody else, like a friend or family member or colleague, and you're like, hey, did you also see that thing that I just noticed? And they're like, yeah. What do you think about that? And then you have a conversation about it, right? And then you start like moving the observation forward to from a singular observation to a collective observation where you have a group of people who are all witnessing the same thing. And then you can start to
Yeah.
say, oh, this is repeatable. Okay, it's repeatable. Now let's try to test it in a scientific way. And so I think that we are going to find out that everything, like from telepathy, ESP, nonverbal communication, who of which I know many leading scientists who are now studying this stuff.
Wow.
I am confident that with the right kind of experimental design, we will prove these things to be real. It's just that
Wow.
the limits are not the limits are that are imposed that are have prevented us up until this time to prove that it's real are the experimental design and technology limitations by which we measure it repeatedly. Seeing it and experiencing it is one thing, but then how do you quantify it so that you can measure it repeatedly over and over and over again and prove without a doubt, like beyond any reasonable doubt, this is a real effect that I'm measuring. And I think that's always been the challenge with proving that natural techniques, plant medicine, tribal techniques, Eastern medicine techniques, hand holding, gratitude, you name it, right? Breath work. That's always been the barrier to proving that those things work. But guess what? They're batting like at least 95%.
Right.
Now science is starting to catch up and actually be able to design elegant enough experiments with modern technology to measure the outcome of these things. Like all of those things work. So
Yeah.
as science catches up, I'm fairly certain we'll prove that most of this stuff is real.
Oh my gosh, this is so cool. Well, it's interesting because, like you mentioned, I mean, if you speak to certain tribal communities, your dreams do mean something and you can sense things and you can communicate differently. So it's kind of like we're the ones having to catch up, right? I'm curious to know your thought about near-death experiences. Is this happening in the brain? Is it outside of the brain? People's own biases, does that impact a near-death experience? Are there hallmarks of certain NDEs? Has that been an area of study for you or fascination for you?
And it's certainly been an area of fascination. It hasn't yet been an area of study for me, mainly because I just haven't had access to these kinds of experiments.
Yeah.
But I'm a big fan of Dr. Rick Strassman's work,
Okay.
who did some of the original intravenous DMT experiments that Joe Rogan wrote up as the spirit molecule and then public or maybe yeah, I think Joe Rogan and Rick Strassman wrote it as a spirit molecule and then published as a movie. I think it's on Netflix. It's quite good.
I'm gonna look it up. Yeah.
Yeah, and what's really interesting, I mean, Rick Strassman devoted a huge amount of his life to studying near-death experiences. And what's really fascinating about his work and then the work that others have repeated since then is that near-death experiences have a lot in common with each other. A lot of the same things people report, like the world is closing in on them, and then they're like in a tunnel, and then there's like a bright white light at the end, and then they emerge from the bright light and they see like colored patterns and textures, and like, there's just certain repeated things that are experience parts of the experience that people that repeat for people,
Right.
despite background and despite past experience and all that kind of stuff. And Rick Strassman thought, well, maybe I think we had known before he started his work that there was a burst of DMT from the pineal gland, DMT being dimethyltryptamine, which is one of the most common psychedelic molecules in the known universe.
Yeah.
And that this was released from the pineal gland in our brains when we die. So Rick thought, well, what if we just administer this to people who are alive? Will they have the same kinds of near-death experiences that people have when they're actually having a near-death experience? And it turned out they pretty much did. Their experience was almost identical with artificially administered IV DMT as the people who had had near-death experiences. That's fascinating. So I think you asked, like, is it happening outside of us or inside of us?
Yeah.
It certainly starts inside of us,
Right.
right? Like the experience, we're talking about what a near-death experience is from a perceptual perspective.
Yeah.
It seems to start with a huge burst of DMT from the pineal gland, which is in the center of our brains, that probably bathes the entire brain almost immediately. Um,
Jeez.
and that triggers the rest of the near-death experience. And if people come back, then the pineal gland seems to stop secreting DMT. And if people don't come back, then there's probably a much bigger burst, and then people pass on to the next life.
Wow. So wild. Is there a certain theory or something that's kind of in the early phases right now that you are especially fascinated by or excited about that, if substantiated, would just be reality shattering for all of us?
Yeah, I really like that question. Well, so the mission I'm on as a psychiatrist and a translational neuroscientist is to cure mental illness. And I
Yeah.
believe firmly that based on what I've learned over the many years of my training and my work, that it is possible to see it happen. And I believe that we can get there as a society with a concerted effort. And the interesting part about that is kind of how do we get there? And so part of what really inspired me to start doing this work was I was treating veterans with very severe PTSD and who were just never getting better with all the best treatments we were taught to use in the Western mental health space.
Right.
None of those people were getting better. They were either staying the same or getting worse. So I thought I started reading up. This goes back to 2012. I started reading up on MDMA assisted therapy. MDMA is 3,4-methylene dioxymethamphetamine, which is a psychedelic of the phenethylamine family that is related to methamphetamine, which is what's in Adderall or other ADHD treatments,
Yeah.
but it's broken down much more. And it's a stimulant psychedelic that specifically targets the emotional cortex, like the limbic system of the brain and the safety systems in the brain, which is really interesting. It started to be used to treat PTSD back in the 80s, maybe late 70s, but definitely the early 80s, and couples therapy back then it was used for. And what was so interesting when I discovered it in 2012 in the research was that it had been used in clinical trials with the same patients that I was seeing in my clinic who were just absolutely struggling all the time with our current treatments. And it was they saw this very interesting phenomenon, which was that with just 3 doses of MDMA, so put it into perspective, my patients are taking like 3 to 15 different medications every single day, ongoing, with indefinite time when they can stop. And generally speaking, we don't tell them to stop. So 3 to 15 medications every day. With MDMA therapy in the phase 2 MAPS trial, just 3 doses of MDMA plus 42 hours of psychotherapy total over 12 weeks resulted in a 55% remission rate 2 months out. So 55, our patients, we had like a 20% remission rate in these patients.
Yeah.
They're seeing, MAPS was seeing a 55% remission rate at 2 months after treatment was stopped, after this 42 hours of therapy and just 3 doses of medicine. So that in and of itself was like
Wow.
radical. Yeah, that was a wow moment. Then they did the 1-year follow-up publication, and that really blew me away because at the 1-year follow-up from the time when these folks finished their MDMA treatment in the study with the 3 doses and the 42 hours of therapy over 12 weeks, at 1 year out, after no additional treatment was administered of any kind that was from the study, people did their own things, but there's no additional study treatment. That number, 55%, went up to 67% without any additional treatment.
Oh my gosh.
So more people were better at 1 year out than right after the treatment without any additional treatment. We have never seen anything like that in the history of mental health or psychiatry. The only kinds of medications that induce that kind of effect where you take it for like a concerted course of like 1 to 12 weeks and then you're done and then you continue to get better after the medication has stopped are antibiotics for infection.
So crazy.
So when you think about that, antibiotics are helping facilitate the body's ability to fight off the infection itself. They don't actually kill the bacteria, they just weaken it. The body can kill it. It's kind of the same thing with psychedelics and MDMA. MDMA is weakening the terrifying nature of the trauma, the terrifying perception of the trauma to make it seem less terrifying, more approachable, and enhancing safety so that the person who's struggling, they can process it and work through it and remake meaning around it. And that effect continues afterwards because they've just remade the meaning around the experience and had altered their perspective of themselves for their whole lives. So when you think about that, you can measure that improvement that people have at 1 year out or from 0 to 12 weeks and at 1 year, and you can measure it by looking at the epigenetic code. And the epigenetic code is a layer of code on top of our DNA, which is the same in every single cell in our bodies. Every single cell except sperm and egg has identical DNA, but somehow your hair knows how to be hair, and your skin knows how to be skin, and your heart knows how to be heart, because there's another layer of code called epigenetics that tells the heart to turn up heart proteins and turn down skin and hair, and tells your hair to turn up hair proteins and turn down everything else, and vice versa for all your other cells.
In layman's terms, we could change our genetic code, basically. Epigenetic code.
If you change your genetic code, that's often when people get cancer. So our epigenetic code, epigenetic means on the DNA. Think of genetic meaning like in the DNA or the DNA. Epigenetic is the code layer that sits on top of the DNA. It's just changing these little markers that tell the DNA to either turn stuff up or turn it down.
Gotcha.
So that's actually what's happening. And if you think about meaning making, in all likelihood, how meaningful your experiences are is actually radically shifting your epigenetic code around stress and fear and safety in real time. This is not like a once in a while thing your epigenetic code decides to update, or that you were just born with it and it's that way for life, like your DNA, which it is that way. Your epigenetic code is, from what we can tell, updating on the fly all the time. And so when you have a severe traumatic event happen, and then somebody tells you, why'd you let that happen to you, right? Like, why'd you let that happen to you? And then they blame the victim and then victimize you more, right? And then you adopt that victim mindset of like, well, now I don't know, I'm not sure I can keep myself safe, so I better be on guard all the time, and et cetera, et cetera. Then when that experience happens, you're likely having an epigenetic shift to your cortisol receptor genes in that moment. So there's a real-time biological correlate to our conscious experience. And that's what this work is really discovering. And that's how we get from illness and a sick, overwhelmingly sick society to a cured, healed society. And it's really about like understanding the relationship between what's changing in here and our felt conscious experience, which we're like just on the tip of. So that's really cool, because you can have one code base, which is called DNA, and then it makes everything in your whole body, the whole millions of different kinds of cells. That's pretty miraculous, and it's all because of epigenetic markers. So epigenetics was something that came up with Eric Kandel's work around memory formation. To make new memories, you have to have changes to the epigenetic layer, and trauma causes epigenetic changes as well to cortisol receptor genes. So we thought that perhaps if we wanted to look at what was changing, like what was actually being impacted in a measurable way by something like MDMA therapy, was having such a powerful effect on these people with PTSD, why not see if that epigenetic marker that PTSD is highly correlated with on this cortisol receptor changes? Because if MDMA actually changed the cortisol receptor epigenetic code, that would actually last a year. And that would be consistent with people staying better, even though there's no additional treatment.
It's just incredible. But we're still kind of far out from seeing how that person might be like decades from now. We just have maybe short term, or do we have the long-term evidence that it stays like that?
We know that it stays for at least a year.
Wow.
Or not stays, not the effects stay, they get better for at least a year from MDMA specifically. It's even better than a lasting effect. It's like more people are better at 1 year out than they were right after the treatment ended.
Wow. But we don't know at 5, 10, 15 years that is incredibly promising.
And I think the next layer that's like really paradigm shifting that one of my colleagues and I broke the ice for was this idea that, is the traumatic memory that's stored in the body, in fact, reversible or repairable? Because we didn't really know up until, right? We knew that trauma causes these biological changes to our epigenetic code. It changes cortisol receptor functioning. It changes lots of other stuff. But is that repairable and renewable? Can it be fixed, and will it stay for the long term? And so we decided to measure it, and we collected epigenetic saliva data from saliva samples in people who went through the MAPS phase 3 trial, and measured their epigenetic code on the specific cortisol receptor that was impacted by trauma before and after they received their 12 weeks of MDMA therapy. And we showed that there was a direct and statistically significant relationship between how much people responded to MDMA therapy and how much epigenetic change on this receptor site they got. So the more people responded in a positive way to MDMA assisted therapy, effectively, the more epigenetic remodeling they had at this cortisol receptor site, which means that their cortisol receptor is working more normally, like more like in a pre-trauma state than it was before. And so that is the first evidence, really, that not only that trauma is in fact reversible / repairable, but that MDMA assisted therapy is one of the first techniques that has ever been proven to do it in a short course treatment. Like in 12 weeks, you can induce a shift in these markers. And that was never known before. So like when you think about how that impacts mental health moving forward, now we have a framework. We know what genes to look at. We know what epigenetic code to look at. We can start to compare all of the treatments we use for mental health in the same way. And when we start to make a map of how all these different treatments are changing, or in one way or another, changing the epigenetic code when we treat people, then in 5 to 10 years, when we have like a few thousand people that we've tested, you can, rather than walking into your doctor's office and filling out a survey and being like, oh, looks like you're depressed, here's a prescription for some medicine, take it for life.
Yeah.
And here's your diagnosis. You're going to walk into your doctor's office, you're going to spit or pee into a cup. They're still going to ask you the same questions about your mood and your anxiety and your stress and your sleep and all of that. But then rather than handing you a diagnosis and a prescription, they're going to hand you a prescription for life. They're going to hand you a prescription to remission. And it's going to say, based on your epigenetic code, and what your symptoms are, we know that there's going to be a 90% chance for you to be symptom-free at 1 year out with the following treatment. And maybe that's like 12 doses of ketamine and like 20 psychotherapy sessions, or maybe it's 3 doses of MDMA and 42 hours of therapy, or whatever it is. But maybe it's no psychedelics, and maybe it's just like 100 hours of cognitive behavioral therapy with a really well-trained CBT therapist, right?
Yeah.
But the point is that we will be able to figure that out and get people. That's the curative piece, right? We'll be able to actually look at the code, and using AI, this is actually a great use of AI. If the code is so massive, we can't process it in our own heads. It's impossible. Billions and trillions of combinations. You can feed it into an AI and just be like, okay, what are the chances of this person with these symptoms and this epigenetic code baseline? What are the chances of them getting to remission and no longer being symptomatic with any of the following 10 treatments? And then the AI just calculates it and gives you your most likely treatment outcome. And that's how mental health, I foresee that's in the next 10 years, that's how mental health is going to transform.
This cracked my mind wide open. I have 1,000,001 more questions that I didn't get to, so I'd love to have you back on the podcast. Where can people find you and your work and anything that you want to plug?
This is really fun. Thanks for having me. You can find our technology, Apollo. It's basically a very gentle, silent sound wave technology that we developed out of my research into MDMA therapy, because when I realized that MDMA therapy's major benefit to the body was safety from a biochemical and psychological perspective, I just started diving into that. And I said, well, what if we could tap into technology to help us feel safe on the go? And so the Apollo's vibrations are very special vibrations that are layered in a specific way that boost safety feelings in the body and increase vagus nerve activity on the go. It helps with sleep, focus, stress, energy, lots of different things. I've been wearing it every day for like 7 years since our first prototypes. So highly recommend.
Amazing.
It also makes psychedelic experiences safer because it helps you feel more grounded and in control in any moment at a time where you might be out of sorts and underprepared. Yeah, so if you want to check out Apollo, it's apolloneuro.com. If you can't remember that, check out wearablehugs.com. And if you have an iPhone, you can actually try Apollo for free, which is a new feature we just released. And you just go to the App Store on your iPhone and download the Apollo Neuro app, APOLLO space NEURO. And then it will give you Apollo vibes for free on your iPhone on us. And you can share them with other people who have iPhones. So you could share hugs now with your iPhone, which is really
We need that. We need that more than ever.
Yeah, seriously. That's why I released it. Amen. And if you want to find me, I'm on socials at Dr. David Rabin, and I'm always happy to hear from you, mostly on X, Twitter, and Instagram. And then I have my personal website and professional website is drdave.io. And then I have 2 deep dive shows into brain consciousness and how the brain works called Your Brain Explained on Spotify and Apple podcast. And then another about the latest news in the psychedelic space that comes out every couple of weeks, which is called the Psychedelic Report, also on Spotify and Apple Music.
Thanks for hanging out with Self-Helpless. Feel free to share this with someone who could use it, and you can binge related conversations linked in the show notes. Ad-free episodes are now available on Patreon, and because I'm practically allergic to social media, the best way to get notified about new episodes is to subscribe wherever you get your podcasts, or join the email list at selfhelplesspodcast.com, where you will also find some free goodies like a watch and read list and the quote buffet. All right, love you big time, and thank you so much.